Welcome to this BMI Healthcare podcast, and in this podcast we are discussing bowel cancer and the journey from awareness to screening, treatment, and also looking at the emotional impact on patients and family members. And I have a panel of experts here with me to do this, and I'll let them introduce themselves.
Hi, I'm Deborah Gilbert. I'm the Chief Executive of Bowel and Cancer Research. We do pretty much what it says on the tin, really. We're a research funding organisation that specialises in funding the best science anywhere in the UK, looking at new ideas in the treatment of bowel cancer and other bowel diseases, as well as which we support our future experts by providing funding for PhD studentships, alongside which we work to involve patients and their carers and families in the entire research process.
Good morning, I'm Stéphanie Leleu. I'm the oncology lead nurse. I work for BMI Private Hospital, the Children's Hospital. There is actually in the country 59 BMI private hospitals in the UK. My role is oncology lead nurse. I'm in charge of the oncology units at the Children's Hospital, and I work very closely with bowel cancer patients and also with other type of disease.
I am Vivienne Powell. I work as a receptionist in the BMI Woodlands Hospital at Darlington. My expertise in this today is that I am a bowel cancer patient. I was diagnosed with bowel cancer in 2012, and then I was diagnosed again in 2014. So I have 5 years experience along the cancer journey.
I'm Judith Brodie. I'm the Deputy CEO and Director of Services for Beating Bowel Cancer. Beating Bowel Cancer is the support and campaigning charity for all those affected by bowel cancer. Our support and information is extensive and focused on the needs of those affected by bowel cancer. We have extensive information on our website, beatingbowelcancer.org, downloadable booklets and fact sheets, and a nurse advisory service for specific inquiries. We also have a very active online forum which is available for peer support for those affected, both patients and friends and families.
Great, so we have a panel that can provide us a wealth of insights into the issues. And so to kick off, we're looking at the awareness of bowel cancer. And Judith, perhaps if I can ask you, how aware do you think we are in general in the UK of bowel cancer?
One thing I would say is when you say to people that bowel cancer is the second biggest cancer killer, they are astonished. They don't put bowel cancer sort of up there with breast cancer, prostate cancer and lung cancer, and yet it is one of the 4 main cancers that affect people in this country. So how aware are people? Not enough, I think is what I'd say.
Viv, how aware of bowel cancer were you before the point at which you were diagnosed?
I think only very slightly, really. One of my parents' friends I knew had a colostomy bag. I'm assuming that was to do with bowel cancer. But it didn't really sort of have anything that I needed to think about on a day-to-day basis. So really, I have to say, very little. And I suppose now, since I've had nearly 5 years of my cancer journey, I'm so much aware that it's just the norm now for me to know what it's all about and to be quite happy to talk about it. But actually, because it's talking about going to the toilet and down there, people do not want to talk about it. They find it embarrassing. And that's, I think, yes, they'll talk to a nurse, maybe once they've been diagnosed, but prior to that, people don't generally talk to their friends about what's happening when they go to the toilet and looking at their poo or looking at the tissue paper.
Judith, this seems like there is a real challenge here in terms of getting that awareness of people, because unless you have a personal experience, unless you've been touched by it yourself in some way, it's very hard to kind of get a message across, I guess, to an uninformed audience.
I think that's absolutely true, and I think even in families sometimes, as Vivienne said, not everyone talks about their their experience. So you might know Uncle X has had cancer, but you may not know the details of it, and that's part of this. And I think the other thing to say is that it differs in different communities. So if you look at the screening rates, particularly the uptake of bowel cancer screening, and I'm sure we'll come on to that, there is a national screening programme across the 4 nations of the UK, but there are very different rates of uptake in different communities. Real inequalities, and we're nowhere near tackling those. So you've got an uptake of something like 30% in some communities, and the average across the country is, I think, 54% now, which it compares to 74-75% for breast and cervical. So that's really worrying as well, and that's part of this whole picture, I think.
So what is there that can be done to get those rates up?
So there are national screening programmes in all the 4 nations, and so there is the opportunity for everyone at different ages, 60 in England, and we want that changed to 50, and 50 in Scotland, and it's still 60 in Wales and Northern Ireland as well. But there is the opportunity, if you've reached that age, to have your poo tested through a bowel screening kit that comes to you by post. So it's easy to do, you do it in your own home. And I think what we'd say is just get over the taboo, just do it. I know some people get queasy about thinking they're going to take a sample of their poo. This could save your life, just do it.
Lots of people that I've spoken to have said, oh, my friend's had one of those and she won't do it. And I said, can you please tell her to do it? She said, oh, I am. So because I'm telling them, I'm still here because, it was diagnosed, I've been treated, why wouldn't you?
Yeah.
Why wouldn't you do it? And by talking about it and telling other people, look at me, I'm fine, I'm running marathons still, I'm absolutely, doing everything I could do beforehand, that before I had cancer. Why don't you just get it sorted? If you leave it too late, you're not going to be able to do what you wanted to do. Yeah. Life's not going to be the same. Whereas if you can get there as soon as possible, so that's from my point of view, talking about it, getting that message across to as many people as possible. I mean, my husband, when I first sort of was telling people, he went, oh my God, what are you doing? And he was almost like cancer's, not just bowel cancer, but cancer's almost shameful. And I'm like, I'm not ashamed that I've had cancer, and I'm not ashamed that I've had bowel cancer. Mm-hmm. Yes, it's a bit of a bummer, and I know that's a bit of a titter thing, but that's the way I've got round it myself. And he always said I was very upbeat about it all, and I was like, I'm going to get over this and be positive. And that's how I've got through it. Mm-hmm. And why people do not want to do this poo test that comes through, I do not know. But hopefully, if we get more people on board to say, right, let's do it, look, this is all you've got to do, it's dead easy, this is...
It's free of charge as well.
Yeah.
Yes. Can I just highlight the statistics which reinforce Vivienne's point, that if you get diagnosed at stage 1, so early stage, your chances of still being alive 5 years later are 97%. 97%, that's almost everyone. If you're diagnosed at stage 4, it's 7%. That's the difference. This is a really treatable, manageable cancer, and more so if it's caught early, as in Vivienne's experience. And it's really important we get that message across to people, because I think people hear cancer and they think, oh my God, I'm going to die. And actually, this is so treatable, particularly if caught early.
It is. And I mean, although statistics say that most people are over 70 when they first get diagnosed, I was 48. And I think the statistics are like 4,600 people, 50 to 70, are diagnosed a year with bowel cancer. So if we can save that many people, that's massive. It is a massive amount of life saved. It's just passing that message on and asking people just to not be ashamed of talking about poo, of actually looking at it, dealing with it. I mean, for women, many women who've had children, they're dealing with nappies.
Yeah.
It's not that much different.
I think women are slightly different than men.
Yes.
So I think anecdotally we've always heard that it's the woman who encourages her husband or her partner to go to the doctor. It's not something that men will necessarily do off their own back, and that there is research to show that they can be quite fatalistic oh well, que sera, sera, whatever happens, happens, whereas women are a little bit more proactive in terms of managing their health.
And also I think women are more prepared to talk to their friends about a lot of things, whereas men, I don't think actually share or open with their mates, if you like, that type of closeness.
I think exactly as Viviane says, most diagnoses are in the over 60s, but bowel cancer can happen at any age. It's men and women. Some remarkably young people have been diagnosed with bowel cancer, so if you have symptoms, whatever your age, get them checked out.
I think also, so like we discussed before, people who are over 50 years of age will have been more at risk to get the bowel cancer. But we have to take into consideration also the lifestyle, unhealthy lifestyle. For example, obese people may be more prone to develop bowel cancer. People who have polyps. The reason why they check for polyps is because if you don't remove the polyps a few years or few months down the line, it could transform to cancer. Also, people with Crohn's disease and ulcerative colitis can be more prone to have bowel cancer. And a small percentage, but it's still there, it's about a strong history of bowel cancer. For example, if you have somebody close to your family, like your dad or your sister or your mother who had history of bowel cancer, it's very important that you get yourself checked as well.
I'm not sure actually if one of the key messages we shouldn't be pushing out is how important lifestyle is in relation to bowel cancer. There's current research, I think, to show that around 50% of bowel cancer could be avoided with changes to lifestyle, and that's around what you eat and what you do. So the amount of exercise you take, smoking, alcohol, eating red meat there's a lot of evidence to show that eating red and processed meats, actually there is a very significant risk associated with bowel cancer. And I know that whenever we say something like that, we will always hear, my husband, my wife was a vegetarian and ran, and people need to understand that risk is not you will get it or you won't get it if you do this or you don't do that. But the evidence is very strong that lifestyle plays a big factor in bowel cancer, actually. So that's a really key message for us, I think, to get out as charities and also as individuals and companies.
That's the end of this part of the discussion. Thank you all for being here and sharing your experiences. If you want more information, look out for the other episodes in this series and visit our website at bmihealthcare.co.uk. Look out for the Be Bowel Cancer Aware campaign page where you can download our awareness guide.